And joining me now is our Medical Officer of Health, Dr. Paul Roumeliotis. Welcome back to the show, Doctor.
Good to be back.
All right, so we know that we have some concerning numbers, both locally and in the province. We know the Premier made some announcements today, but I want to start with, of course, the local. And we have seen a steady increase in cases here, including today, one new case in Cornwall.
Yes, we're up to 223 cases right now. And then if you look at the trends, we were pretty good between June, July, and the middle of August. And since the middle of August, we've seen a trend of increased cases. We're over 30, 35 cases just in that span. And so we're trying to look at where these cases are coming from. Certainly some of them are from clusters of people getting together and not social distancing. Some are from parties in Ottawa, some are from parties in Quebec. But the bottom line is that our numbers are increasing, which reflects what we're seeing across the province. Over the last couple of days, the Ontario numbers have been in the 300 range, particularly in the Ottawa, Toronto, GTA area. And so that is worrisome to us because we want to be able to, go small peak and bring it down, small peak and bring it down. That's what we need to do. We don't want it to become a big wave. And so it's important for us to ensure that our social gathering numbers and so on are respected. And this afternoon, the province announced that the hotspot areas, for example, Ottawa, Toronto, and Peel, the public gathering numbers are 10 for indoor and 25 for outdoor. And this only applies to private parties. And it doesn't affect restaurants or business or anything like that. And so it's quite important for us to be very, very diligent in our area as well, to be able to ensure that when you get together, you need to socially distance, put your mask on, and don't go to parties or guests or visit other people when you're sick. We've seen that in a couple of cases, and really that should not be happening, because together we can decrease the numbers. We know that there's been an outbreak in Pembroke in a school. Those were cases that were brought in from the outside into the school. And so we don't want to do that. We also know that in Ottawa, they've had now 2 new outbreaks in long-term care facilities and 6 deaths in the last 2 days in those long-term care facilities. Let's together, Cornwall, SDNG, Prescott Russell, all our area, we need to buckle down at this point and to ensure that our numbers don't creep up, go the other way, go downwards, keep the numbers of infection low in our community. And that way we will be preventing these infections from entering our schools. We just started schools, a week ago, and our long-term care and retirement home facilities.
Absolutely, and we've noticed this trend since July, but of course it's only being exacerbated now. We're seeing that really the demographic that is transmitting the disease and catching COVID is under 40. I mean, I think people in their 20s are something like 4 times more likely to catch the virus. And I just want to touch on that because, number one, there's sometimes sort of an idea out there that if you catch it at that age, it's not really going to do anything because it's more the older demographic that is more at risk of passing away. But let's talk about that because the older demographic can catch it from the younger, but as well they're discovering more and more long-term effects of COVID-19 when a younger person catches it.
Exactly. While the majority of people, particularly younger people, don't have any long-term consequences, we obviously know that it can kill the elderly, obviously. And yes, you're right. The patterns now are shifting to the less than 40-year-olds. But we do know that this is a very, very peculiar virus. Unlike other viruses, this one gets into the blood and actually can cause the blood to clot and cause strokes on top of it all. Cause heart attacks, all these things. So it's really not just a simple virus like the flu. It's got very more dangerous components to it. So the young people, yes, most of you, if you get it, it'll go away. You won't be that sick. But there can be some complications. But for the most part, the biggest complication, as you said, Gabriel, is the fact that these individuals will then spread it into the community, to the vulnerable population, which we don't want to happen again. We saw what happened, this catastrophic effects of it to our long-term care facilities in March, and we don't want that to happen now. So it's a community effort to protect our vulnerable ones. And you know what? I can't guarantee that if a 30-year-old gets COVID, that they won't require hospitalization or won't have long-term consequences in their lungs or from blood clots and those type of things.
Absolutely. As you alluded to, I mean, it's up to all of us to really buckle down, and we know more about the virus than we did 6 months ago. So hopefully people can be aware of that, be cognizant, look at the trends, and really get that trending down. Now, another thing we're seeing, Doctor, in this area is our assessment centers are certainly flooded with people wishing to be tested.
Yes, and that's a result of the fact that we started school now, and kids and families are going to get their kids tested, obviously. So it has overwhelmed the system. As a matter of fact, it's overwhelmed all of Ontario, Ottawa, and so on, and has overwhelmed Quebec as well. So what we're trying to do is there are going to be solutions moving forward. I know that there's going to be testing available in pharmacies and other retailers that have pharmacies in there shortly. There will be an announcement likely next week by the Premier. But in the interim, what we're trying to do is we're trying to increase our capacity in our office, in all of our health units. Some of our assessment centers are getting a lot of people from Ottawa as well. So we're talking with the Ottawa Hospital and others to increase our staffing, see what we can do. We're looking at relocating our Castleman testing center to a more central area along the 417 to be able to do more tests. But also what we're asking in the interim is that if you don't have any symptoms and have not been asked by public health to go get tested, please do not go get tested in the interim as we beef up and ramp up our assessment centers, because we really want to be able to test people who have symptoms, and particularly young kids in schools or people that work in schools, which will take priority. So for the time being, we request that. We have made the same request. My colleagues have done so in Ottawa, in Leeds, Grenville, as well as Renfrew. Please, like I said, if there's no reason to get tested at this point in time, please do not go, because we need to prioritize people that are symptomatic, and particularly focusing on schools and personnel at the schools. So, and also remember that around the corner, there are also going to be asymptomatic testing availabilities at local area pharmacies. I'm told there are going to be thousands across the province. So let's wait and see for that one.
Absolutely. And just finally, we've mentioned schools several times. We know that so far it seems to have been seamless in our area, but we have heard, of course, in the GTA, several schools, and of course in Eastern Ontario or Northeastern Ontario, in Renfrew, we've already seen a school forced to close. So maybe we can have an update on where our schools stand in terms of everything.
So far, so good. Working very closely with our 12 nurses that are now working with our schools, working personally almost on a day-to-day with our school board directors. One of the things that I want to stress is that the initial cases in Ottawa that were in the school were actually brought in from the community, and the cases in Renfrew that forced a high school shutdown were actually from personnel of the school that brought it in from the outside. So I think people should know that, and that's again an example of what I was saying. It's from the community that goes into the schools, and that's what we need to stop.
Absolutely, and I think we'll just finish off by saying that right now across Ontario, they're estimating that roughly half of COVID cases are from the community with no direct links. So it just shows that the virus is here, as you keep saying, and that we all have to be diligent to prevent worsening in our region like we're seeing in other parts of the province. On that note, Dr. Paul, thank you so much for joining me for this week's update.
Thank you.